I'm sorry. I voted for him. I thought he was going to help folks like me. I really did. Now my SNAP's gone, my Medicaid's gone. They cut off my heat and help last week. I don't know how I'm supposed to buy groceries next month or keep the lights on. I ain't got no.
I'm getting bills in the mail nearly every single week. Here's another bill for $1,261. What's the description for? Actually, it doesn't even say.
But girl, let's clear a few things up. You supported your own demise. Again. You actively support an administration that passed things like the One Big Beautiful Bill, which made healthcare prices go up for millions of Americans, directly and indirectly. It just so happens to be affecting you now. Because this is part of a whole domino effect. When hospitals lose Medicaid funding, they only have a few choices. They can close, lay people off, or raise prices to make up for the funds they lost. It's also well documented that when hospitals close, surviving hospitals increase their prices because there's fewer options and less leverage for insurance providers to negotiate lower prices. And that's if they can get care at all. Riley, I know we're just talking about your problems, but consider that Trump's policies have created care deserts, so many expectant mothers are left without access to care at all. Fewer options for care, and it's more expensive. That's what this administration you support has accomplished so far.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends.
This is quite literally what you voted for. Why are you so confused? You voted for the man that wanted to take away Medicaid. He took away the Medicaid, and you're shocked? You can't afford your medicine? Oh, don't worry, I'm sure that Doge check's still on the way. I do not care. I legit do not care about any of these people. They voted against their own interests. They voted against themselves. Why should I give a fuck that he can't afford his medicine? He should have thought about that before voting for the candidate that wanted to make it so he couldn't get it. Call me selfish, call me heartless. I really don't care. These people fucked around and now they're finding out. I don't care.
He doesn't care about us. Somebody asked him about a week ago, what about the American people? And they're struggling right now.
To what extent are Americans' financial situations motivating you to make a deal?
Not even a little bit.
He did not care. I couldn't even watch that. I was angry after that. Like, I voted for you and you don't care about me?
More Trump voters are publicly regretting their vote for Donald Trump as he continues to back out of campaign promises and instead focuses on his billionaire friends. Now, first it was the Steelworkers Union out of Pennsylvania. Now firefighter unions in New York City are publicly speaking out as Donald Trump and Republicans failed to fund the 9/11 first responder healthcare program that is designed to help the first responders who are still suffering from being there on the ground during 9/11. Now, you can say that Donald Trump had nothing to do with that, but understand Republicans took that out of the funding bill under direction from President-elect Trump and Elon Musk. Now, so far, Donald Trump has only focused on delivering for his billionaire buddies and nonsense such as Greenland, Canada, Mexico, Panama, all this stuff that he didn't talk about. Not once have you heard him talk about lowering gas prices, lowering grocery prices, your energy bill, etc. All the things he promised during the campaign, he is backing out of because he only cares about one person, himself, and the people who paid to get him elected.
Not a socialist, but everybody deserves a right for health care.
That's socialism.
And, well, and you need...
wait. But hang on a minute. You're saying I'm not a socialist, but then you're like, I do, though, want socialized health care. That's socialism.
I don't know if that's called socialism.
It is.
Everybody needs to have the right to have a doctor and be taken care of. And have an advocate that helps you figure this out, because there are none here. There are none.
Yes.
What I'm going through now with your father, it is like,
yes.
But it shouldn't have taken me to be in this position to know this, but it did.
Okay.
So I'm
and that's
here.
fine. And I think that's a very common thing with most MAGA people. It's hard for you to look outside your immediate life to find empathy for anybody in a situation that you yourself are not personally in.
Right.
You are in that now. You are seeing firsthand that the medical system in America has nothing to do with doctors or patients. It is completely run by insurance companies.
Insurance companies. That is
they make
correct.
every decision.
That is correct.
So like Dad right now, Bob, for those watching the show, he's in a rehab facility trying to get better, to get back on his feet. And the decision about how long he should stay in this place is not made by the doctor, is not made by the patient. It is made only by the insurance company, who has a bottom line about profits. That's all that matters. That's how the entire American medical system is run right now.
And we will be kicked out of the rehab facility next week sometime.
Yeah.
Healthcare affects every American, regardless of political party.
But what happens when medical bills keep rising and coverage becomes harder to afford? Are today's healthcare challenges the result of politics or a much bigger problem? Let's watch more clips and we come back to talk about it.
I gave birth to this perfect, precious little angel in September of last year. It is April, nearly May of the next year, and I am getting bills in the mail nearly every single week. Let's look at them. Okay, this one is a bill for $2,000. The service description literally just says vaginal birth. Here's another bill for $1,261. What's the description for? Actually, it doesn't even say. Here's another one for $336. The service description is subsequent hospital care. What does that mean? Here's another $675 charge for hospital discharge day. What service is it? You're just charging me for discharge day? It says on this bill that our insurance information wasn't provided, but our insurance was provided on every other bill. I don't know, none of it makes sense. My husband just called, he was on the phone for 20 minutes, and we got no answers. They said they could get back to us in the next 90 days. You have to assume that they just hope people pay these without asking any questions. Since President Trump has signed his executive order for hospital price transparency, only 1/3 of hospitals are in compliance. President Trump has done what he can do. We need legislators to act to rein in these unchecked practices and to protect patients and taxpayers from a system designed to exploit them. The markups and the confusion are out of control.
This is Trump care. And Trump care means 17 million Americans losing coverage. It means rural hospitals closing. It means patients paying more out of pocket and having to drive further to get care. This is a fundamental and dangerous rehaul of our healthcare system, which, to your point, is a delicate system and all of the different aspects work together. But what's so incredible is that so much of this bill is inserting waste into that system. It's inserting waste into the Medicaid program and the Medicare program by adding excessive paperwork, excessive bureaucracy. They are importing the worst parts of the private healthcare system into Medicaid and into Medicare to make it more complicated, to push people off of care, to make people just give up entirely around getting care. I think this big ugly bill needs to be doged. They need to remove the waste from this bill because it is excessive. And to your point, this is all about tax breaks for billionaires. The entirety of this bill is about tax breaks for billionaires, and to just partially pay for it, they are handing the bill to Medicaid patients, they're handing the bill to Medicare patients, they're handing the bill to hungry families, they're handing the bill to state governments, they're handing the bill to healthcare providers, they're handing the bill to future generations. I understand why this majority doesn't want to have their fingerprints on these cuts. They're trying to push off the difficult choices to state governments. They're trying to make it the fault of patients who can't keep up with the paperwork. This is trickle-down cruelty.
If they cut our Medicaid, we would lose every hospital in our rural area, and then none of us would have health care. Not just the people on Medicaid, the people who have private insurance and Medicare. I'm a pharmacist. We took an oath to take care of people. We didn't say, no, only the rich ones.
In states that don't have right-to-work laws, the average pay is over $8,000 higher. The main thing that would help coal miners is to pass that PRO Act and repeal a right-to-work to where they could have a union, and that would solve all their problems.
Here's the reality. Healthcare has been one of America's biggest challenges for decades, regardless of who occupies the White House. Millions of Americans continue to struggle with rising insurance premiums, prescription drug costs, hospital bills, and access to affordable care. Supporters of efforts to reduce government healthcare spending argued those reforms are necessary to control the national debt, encourage competition, and make the system more efficient. Critics warn that reducing public health care programs too quickly can leave some families with fewer coverage options, especially low-income households, rural communities, older adults, and people with chronic medical conditions. The truth is, healthcare policy is incredibly complex, and the effect of major reforms often take years to fully unfold. At the end of the day, most Americans are not asking for a political victory. They are asking for affordable prescriptions, reasonable insurance costs, quality hospitals, and the peace of mind that one medical emergency won't lead to financial hardship. That's a goal that crosses party lines. What do you think? Should America focus more on reducing healthcare costs, expanding access, or finding a balance between the two? Share your thoughts in the comments respectfully, and before you go, Do well to like and subscribe to my channel. I'll see you in the next.